Hello and welcome to another Stand in the Gap program. Both Pastor Isaac Crockett and I are so glad that you've joined us today. And with the Lord's help, and we pray for this before we begin any program, every program, we pray that we'll continue here on this program to be a clear conduit of truth as we engage now the second part of a two-part series focusing on the critical issue of health freedom in America. Not just health, but health freedom. Joining us again today is Twyla Braze, President and co-founder of Citizens Council for Health Freedom. Twyla is a recurring monthly guest on our Stand in the Gap international radio program, Stand in the Gap Today, because we have several Stand in the Gap programs, but Stand in the Gap Today program, where we address the specific challenges to health freedom in America and how we as God-fearing people and interested citizens can better understand what is happening, and this is key, understand what is happening and be better prepared to how to wisely and biblically respond. That's our ultimate goal in our prayer. Now, in last week's program, we focused on the diagnosis of the state of health freedom in America here in early 2025. Twyla made it clear that our current state of health and health freedom is not good, either physically or, frankly, in the overall consideration of the culture determining the status of our health freedom, which is also not good. So no matter how you come at this matter of health and health freedom, it's not good. We're sick. Now, last week we focused our conversation on two main pillars which underpin health freedom. They're not the only ones, but they are certainly critical ones. The first is the doctor-patient relationship. That relationship, that word is key. Doctor-patient relationship. The other is the integrity, the overall integrity of the healthcare system, generally including such factors as the degree and type of government control over policies and regulations, which significantly determine cost and quality and, frankly, availability of care itself. So today we're going to continue in this conversation, but shift more from the diagnosis to the prognosis, so looking ahead. And the prescription, which always comes if you go to a doc, you probably end up getting a prescription for something, a prescription for improving our health freedom, and specifically as it relates to the doctor-patient relationship and the integrity of the overall health care system generally. And with that, Twyla, welcome back to the program. Last week was a fantastic program. You did a superb job, and I think Isaac and I did an okay job, but we're glad that you're back with us today.
Well, I'm so glad to be here. Thank you.
As we did on that last one, I'm just going to ask you to repeat just a portion of what you did. At the beginning of the last program, I asked you, like a doctor, you're an RN, you're not a doctor, but you are prescriptive, you are analytical, and you bring that expertise to what you do as Citizens Council for Health Freedom, where you are looking at matters of health freedom and those factors that contribute to or detract from those things that make for a healthy doctor-patient relationship and ultimately better health for patients, all of us who are watching this program. Now, that being the case, I asked you to do a diagnosis, overall diagnosis of the overall state of health freedom in the country on a scale of 1 to 10, 1 being comatose is what I said, dead, not functioning at all, and 10 being in perfect health. If you could, just restate from your perspective, where are we, how would you rate it, and then just briefly why you designate the evaluation the way you do.
Well, I think, as I said last week, that we're in a very bad place. I would put us at 3 to 4, and that's because the whole point of medical care and the whole healthcare system is the patient. But that is not the point of today's healthcare system. You know, at the patient level, at the price level, it's not patient friendly. It's not affordable. The trust in doctors and hospitals is plummeting. Lots of people have said they don't even ever want to even go to one of them. It's not focused on patients. It's not focused on care. And it puts doctors in a bind between what they know is the right thing to do and what the systems allow them to, or even worse, what the systems push them to do for patients when it's not good, as we saw during COVID. So, we're waiting to figure out what's going to happen with Trump, but unfortunately, healthcare is not his forte. It's never been his forte. He calls it very complicated and complex. And so we're hoping that we will move away from doctors being focused on paperwork and their computers. We hope that we can get back to, healthcare that involves touch and eye contact and more time. And we hope that we can actually get back to real insurance, because we don't have real insurance today. We have the corporate version of socialized medicine put in place by Ted Kennedy, pushed by Hillary, and really made the way we have it today by Obama with the Affordable Care Act, where we all have to have a health plan, which is this corporate version of socialized medicine. So we're not in a good place when it comes to health freedom. We're not in a good place at all.
And again, you put your fingers right on spots. We discussed briefly last program, but ladies and gentlemen, stay with us. We'll go into further discussion. And again, we're going to look ahead and we're going to ask Twyla, all right, now based on where we are, what is this year ahead likely going to look like? And then we'll get into some discussion on that and ultimately a prescription of what you and I can do. We'll be back in just a moment.
Truth, flexible or permanent? The Bible, ancient history, or powerfully relevant? Culture, a reflection of enlightenment or warning signs? The pastor, commentator, or frontline combatant? Every day, American Pastors Network speaks to these questions where and when they matter. With hundreds of affiliate radio stations nationwide, a website and mobile app screening today's headlines through the twin lenses of the Bible and the Constitution, educating, informing, equipping. This is the American Pastors Network. The time is now to stand in the gap for truth.
Watch Lighthouse TV wherever you go. Available on Roku, Amazon Fire TV, and Apple TV. You can view our in-house studio productions on demand, or watch what's on the station right now with our 24/7 live stream. Search Lighthouse TV online on your streaming device, or go to our website for more information. Visit lighthousetv.org to stay connected. There you can find out what's currently on the air and coming up, how to watch in your area on cable, satellite, broadcast, or streaming devices. Watch past programs or our live stream. Follow us on social media and learn more about the station, our hosts, and our programming. Lighthouse TV, positively different.
For over 2,000 years, pastors have carried the light of the gospel through opposition, persecution, and every flaming arrow of the enemy. But sadly, now more than ever, our nation is experiencing a period of spiritual darkness. But what would happen if churches threw off the shackles of fear and boldly stood for truth? If 100,000 pastors around the nation joined together and committed to preaching God's word no matter the consequence? Pastors who are unaffected by changing times and the opinions of men? What would happen if America's pulpits became aflame with the preaching of righteousness? the great darkness from rejecting God's standards would be expelled, the prayers of God's people heard, our nation healed, and God's blessings restored. The time has come to stand.
Welcome back to Stand in the Gap. And as we continue to talk with our friend and a regular guest on our radio program and on our television program, Twyla Braze from Citizens Council for Health Freedom. Last week, if we were listening to this in chronological order, we had a program, and Twyla helped us diagnose the problem with healthcare in America. If you go to our websites and listen to her, if you stream from our app, our radio program, you'll hear Twyla Braze Health Freedom Minute from cchfreedom.org. And so you could go to her website or our website and hear more from her. And you'll hear her diagnosing, like she did last week, the state of the health in America. So if we could, Twyla, kind of go back in time. You're the emergency room nurse and you're triaging a patient, except it's not some child coming in saying, my head hurts. It's the patients of America saying, I'm scared to go to the hospital. I can't afford a doctor. Something's wrong. And maybe they don't know what's wrong. They're just telling you where the pain is. And it's a painful experience right now. And so you've gone through and you've diagnosed, this is not good. We're in a bad situation. You've talked about it. What is the prognosis? What is the prescription for this? That's what we want to get to. And so I'm very curious what you see this year of 2025 as we're still towards the beginning of that. We've seen some major changes. What sort of things you think might be in line? You are involved with a lot of things. You know a lot of what's going on. What are some of the things you're seeing right now that you think will affect what is happening to the health of America, even starting this year?
Yeah, so we can look at what's happening coming out of the Trump administration, and we can see the executive orders, and we know that HHS is being forced to, and that's the U.S. Department of Health and Human Services. It's being forced to terminate a whole bunch of people. There are people being terminated at the CDC and the FDA and HHS in general. At the point where you and I are talking about this right now, we still don't know how many more people are going to be terminated. Our concern is that they will try to move because of who's going to be in charge of the Centers of Medicare and Medicaid Services, Dr. Oz. As far as we know, he'll be confirmed. We're concerned that it'll try to move more towards Medicare for more people, even maybe taking it down to age 55 or taking it down to 50. That Hillary would actually like that idea. And so I don't exactly know what's going to happen, but it's really my hope that we as an organization can have a serious impact with what the Trump administration is doing, because we want to let people we want to build an escape hatch out of Medicare, because Medicare controls everything in the exam room. And I don't care how old you are. Medicare is controlling what happens in your exam room, even if you're 20 or 30 or 40, because those regulations control everything. And the doctors and the hospitals and the clinics, they don't have like a two-tier system. Well, you're not Medicare, so we'll deal with you differently. You're Medicare, so we won't. It all happens the same way. And so we will not have freedom in this country unless we have an escape hatch out of Medicare and a brand new system for health insurance, even for lifelong health insurance begins. And we hope that we can get the Trump administration to move in that direction.
The appointment of RFK, Robert F. Kennedy, some support, some don't, but he really has taken a position that is strongly anti-big pharma and other things. Overall, just your opinion, what do you think will be, probably prognosis-wise, maybe the biggest influence that may come from the appointment of RFK as Secretary of Health and Human Services?
Well, I think that there are maybe some obvious ones, but I hope there are some that are not so obvious, because I think that what you get out of RFK is really a sense of he cares about people, doesn't want corporations to make them unhealthy or hurt them, like with the vaccines and the different food additives. He doesn't know a lot about Medicare and Medicaid. It's very clear in his testifying before the, Senate committees that was not really something he knew a lot about. I think he hopes perhaps that Dr. Oz will help him out there, but we don't really like where Dr. Oz is going. But because he cares a lot, I really think he really does care a lot for people. I think that he can potentially help stop some of the surveillance, move in a different direction to protect people's privacy. That, after all, is a nonpartisan group, and he's always been a Democrat, not a Republican. And so I think that that's possible. And I also think that when he understands, the health plans and the dangers of the health plans, that he will be more likely to move in the other direction too. It's just a matter of getting into him and saying, here's what you have to know. I need to tell you this from a patient perspective, from a freedom perspective, from a privacy perspective. I know this is not really, where you have focused, but you are in charge of it all. And so, help us out here as a country and as patients and as doctors in America to have a system that really works for patients and allows doctors to sleep at night because they aren't violating their conscience.
And Twyla, thanks for going at that way. And I'd ask all of you who are watching, pray for Twyla and her group as they try to bring that kind of information to somebody like an RFK who leans generally the right direction, responsive to it, that they can carry that message. Now let's go to, you brought up the area of surveillance, when I'm going to take me to an area of complication potentially and concern that out of this administration, because of the meeting that President Trump had with the big tech guys, where the commitment was for $500 billion to go to building out these at least 10 big AI-driven data centers that are connected to our fusion centers. And then they went into the comment, Larry Ellison from Oracle made clear that he brought out the health element, which is why I'm going to bring it in here, that AI is so good that it can actually replace the physician in the class, not the classroom, but the office, and can check a person's blood and in moments come back and foretell what that person's going to get, and then in 48 hours go back and develop an mRNA tailor-made vaccine, quote unquote, to prevent that for that person. To me, that raised a gigantic red flag, and it kind of as another rail that goes into this consideration of health. I ask you your response and your questioning to how you are viewing that, because anyways, I'm not going to put any more thoughts. What do you think?
Well, as you know, we are the medical and to some extent the genetic privacy experts in this country as an organization. And I have so many things that I could say about this question. I do encourage your listeners to go and get my book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, to see where this entire movement is going and why, and the profit that big business sees and big tech sees in the exam room and in patients. And so I am very concerned. And I think it's interesting that Ellison thought that this was a good thing. When Ellison gets sick, I want to know if he wants a doctor who cares about him and can tell him all the nuances of his body and his health and his options, or does he want just a machine who tells him, and will he trust that machine to tell him what he needs to do? Or does he want somebody who actually cares rather than a machine? That's the direction that they're going. It is something that I admit that we are kind of concerned about with President Trump, because we're not sure that he understands that all of this surveillance, all of this AI, all of this is not necessarily good for freedom as a country in general, but for also freedom in the exam room. If you're going to have to listen to machines, which are only programmed by humans and which are programmed according to the biases of the humans that do the programming, you're going to get lies, you're going to get biased they won't be called lies, but they'll be untruths, right? The machines will just give you things that aren't true, and they'll give you things that, they've been programmed to do. But the extent to which a doctor could come up with creative solutions for you and your body, and you're as unique as a snowflake, right? Your DNA is unique as a snowflake. And even the stuff in your DNA does not tell the story. Some of that might not turn on for 300 years if you live that long. And so it doesn't really tell the story of truth. So this entire movement towards mechanization of the entire medical system is dangerous to patients. But that, I think, is where the administration thinks the answers are. And I just disagree.
And I will share from my perspective, I am concerned at that too. And from the perspective that when it comes to if one focuses on efficiency only, which you've been described, we've talked about the corporate aspect of taking over the transactional elements of a doctor-patient relationship and removing the relationship. The AI part concerns me greatly, Twyla, because it has no conscience. No. It has no fear of God because it's not programmed in, and it cannot be programmed in, but it is extraordinarily efficient. So from a business perspective, I love AI. But from a doctor and healthcare perspective, I am scared to death of AI, no conscience, no fear of God, telling me what's good for me. So ladies and gentlemen, I just put that out there. I don't want to put words in your mouth, Twyla, but I think it probably reflects it a little bit. It brings us up to this break. Ladies and gentlemen, stay with us. When we come back, we'll conclude this program. And now kind of shift in light of these things, I'm going to ask Twyla, or actually Isaac is going to ask her, what is the prescription? What does she prescribe now? What should we do individually based on these things?
Stand in the Gap is produced and recorded in the studios of Lighthouse TV. Positively different.
For over 2,000 years, pastors have carried the light of the gospel through opposition, persecution, and every flaming arrow of the enemy. But sadly, now more than ever, our nation is experiencing a period of spiritual darkness. But what would happen if churches threw off the shackles of fear and boldly stood for truth? If 100,000 pastors around the nation joined together and committed to preaching God's word no matter the consequence, pastors who are unaffected by changing times and the opinions of men, what would happen if America's pulpits became aflame with the preaching of righteousness? The great darkness from rejecting God's standards would be expelled, the prayers of God's people heard, our nation healed, and God's blessings restored. The time has come to stand.
Watch Lighthouse TV wherever you go. Available on Roku, Amazon Fire TV, and Apple TV. You can view our in-house studio productions on demand, or watch what's on the station right now with our 24/7 live stream. Search Lighthouse TV online on your streaming device, or go to our website for more information. Visit lighthousetv.org to stay connected. There you can find out what's currently on the air and coming up, how to watch in your area on cable, satellite, broadcast, or streaming devices. Watch past programs or our live stream. Follow us on social media and learn more about the station, our hosts, and our programming. Lighthouse TV, positively different.
Welcome back to Stand in the Gap, as we've been talking with Twyla Braze from Citizens Council for Health Freedom. cchfreedom.org is her website. We've had a lot of information. You've been able to simplify it so at least I can understand it. I think if I'm able to understand it, a lot of other people can get it. And it can become kind of complicated because of all these corporate things. And there can be a part of this, and it's not just with health freedom, but with other things as well, where we can almost want to throw up our arms and say, well, there's nothing I can do about it. And we know from a biblical worldview that God holds us responsible as individuals as well as nations, and leaders responsible for those under them. But for us as Christians, we want to take responsibility for what we can take responsibility for. And so as you give this prognosis, you've diagnosed that we're in a pretty bad state when it comes to our health freedom. But talking to those people who are Christians, who love the Lord, who want to do what's right biblically, what is your prognosis? What would you tell us to do that we can, your prescription for those of us who love the Lord, things that we can do to improve our own health and to, as much as possible, improve our health freedom as well?
Well, I would say several things. So, you said God-fearing people. So fear God. Don't fear man. Don't fear viruses. Don't fear anything else. He's given us protective things. And if it's time to go home to heaven, it's time to go home. But fear-mongering is meant to control you. It's not really meant to protect you. It's meant to control you. So fear not. Then I would encourage you to go to some resources, like we have our discharge instructions online, which tell you how to protect yourself in the exam room. And it's right there in our helpful handouts section of our homepage. And our Medicare How-To Guide, which tells you how to protect yourself from 10 Medicare traps. So there are tools that our organization puts out that we encourage you to use. At the policy level, or even at the practical level, start moving towards cash payment. The only way you really protect yourself in this system is if you hold the money in your own hands. And we're trying to move the entire system to that, to real insurance. And real insurance pays you cash. Then you pay the doctor, you pay the hospital. Everybody knows the prices, and everybody knows exactly what's happening. And cash is power. Money is power. Put it in your own hands. So go find a direct pay doctor, go to the Wedge of Health Freedom, jointhewedge.com, which is our directory of cash-based doctors. And then look at your lifestyle. What are you doing to make sure that you're a healthy person? And is there a purpose in your life? Having a purpose makes all the difference in being a healthy person. So I think there's some things at a personal level. Talk to your doctor. Ask your doctor, is what you're doing for me? This is one of the things in our discharge instructions, the questions. Is what you're doing for me good for me? Is it what you would do for you? Or is it the thing that the computer allows you to do and nothing else?
And Twyla, we're out of time, but you went down through those. Ladies and gentlemen, you can find all of that and more information on her site at cchfreedom.org. I would encourage you to do that. But I hope that this information between this program and last connects with you in many regards. I think it was hopefully practical and give us an idea. Again, not to fear, be aware. Do what we can do. Understand biblical principles. Be wise. Pray for wisdom. Pray for discernment. And know that our choices do have consequences. As best as possible, we make wise choices when it comes to all of these things we've discussed today. May the Lord be with you this week. Stand in the gap for truth as you have opportunity to do so.